Dr. Mark Rosenberg of HowToStretch.com, and today I'm going to talk to you about pulled muscles. A lot of people exercise to their limit and they feel sore afterwards, and actually what you've done is you've torn a couple of muscle fibers, and then while you sleep, while you rest, your body repairs those fibers, and the next day you're either more flexible or stronger, whatever you were working on. In stretching, you're lengthening the muscle fibers. In weightlifting, you're contracting and making the muscle fibers smaller and more compact and strong. If you do an extended weightlifting where you go slow with a light weight and repetition, you're actually making the muscle stronger along its length. But the goal is the same. You're tearing some muscle fibers. Now, if you tear more of them, more than your body can repair, sometimes that's called a muscle pull. I've pulled a muscle. I talk about this on my blog if you want to read more about definitions of pull versus tear. Anytime you contract a muscle, you pull it. It's just that seems to be the common usage, at least here in the United States. When you pull a muscle, you've hurt yourself. Okay, but really you've torn something. I wrote recently that I pulled a muscle in my leg here, which is the first time. I've been stretching for 35 years, and it's the first time in about 33 that I've pulled something, maybe 34. And what's happened is I started running with my dog, and it's just a little bit more activity than I'm used to. It's a trail, it's an uneven surface, and I had turned around and I was making side-to-side movements while I was watching him run towards me. It didn't hurt at the time, but I noticed over the next few days it started hurting deeper and deeper. To give you a little anatomy, this muscle here, the large muscle that pulls the leg together, is called adductor magnus. Magnus is Latin for big. Okay, adductor is Latin for pull together. The inner muscles of the groin are adductors, and the outer muscle are abductors. A-B, A-D. Okay, that's on the quiz. But what I did is I pulled this muscle, or tore it slightly, the adductor magnus and the gracilis, which is right next to it. And there's a groove here. And it didn't hurt too much to touch. But if I did anything that required extending of the legs, like splits, or if I did a little karate, a little side kick, I would feel it here, and it hurt. And it would, sometimes my leg wouldn't extend fully. This is how I go about healing such injuries. First, I isolate where it hurts. I don't lay off exercise, by the way, just to let you know, but I modify what I do. I take my hand and I find what hurts and I dig in there. And right now it does not hurt, because the first couple of days I was digging in there. If you do not work this, you will get an adhesion. Muscles are supposed to slide along each other. Well, if you get an adhesion, they kind of stick. Well, if it stays there long enough, it'll form scar tissue, and next thing you know, you won't be able to move your leg at all. And you could see this in people who have not addressed injuries properly. And a lot of physical therapy offices, that is exactly what they're working on when people have problems with their rotator cuff and their groin muscles and knees. Okay, back to this. When I got in here, you could actually see I'm digging in here, and there are a couple of things. I felt some bumps in there. Now, what are those bumps? Well, a lot of it toxins, okay? The body's repairing itself rapidly. Some of them were very painful, but I would work it. And since, okay, let me back up. Your abdominal aorta comes down this way and branches off, okay, and the return venous system brings the blood back. We want to move everything towards that venous system to get the toxins circulating in your blood, to get them out of your body. So what happens, I'd work it, I'd work it, I'd work it. And I would find a spot in particular that would hurt, and I would dig. And I'm not shy, and it's funny, I've shown this to some people, some friends, patients, students of mine, and they kind of go like this. I said, no, you're not pushing hard enough. And I go to push, and they pull away. They don't want me to do it. But the truth is you got to get in there. And it might hurt. But actually what happens is, as it starts to break up, you'll actually feel the muscles start to roll over on each other, and it will stop hurting. Now right here, okay, I'm working it, okay. Then when I got, so that was the first day, okay, that I did that. And there was a lump in the middle of the muscle there. And I didn't even attempt to do any of the stretches that would hurt. That's key. I would do what I call workaround stretches. So I did not have a problem stretching forward this way. What's the advantage of doing a stretch that doesn't hurt at this point? Well, I'm stretching the adjacent muscles. Maybe not the ones that are directly involved, but the ones very close. That's going to increase the blood supply. It's going to keep them from tightening, and it's going to keep me from compensating. Sometimes if you hurt a muscle on one side of, let's say, of your leg, you might limp, you might keep weight off of it. You start building in these imbalances in your musculoskeletal system that is sometimes very hard to correct. So I got right down on the floor and I started working whatever stretches I could do. And I was surprised. I'd hold it, I'd breathe, I'd do the other side, because even when I do the other side, this is getting a little bit of work. And I would hold it, and I'm not holding it as long as I did when I was working on it, but when I do work on it, this is just for demonstration purposes only. Then in between the two, I would go back and I would dig. I would dig. And I'd feel what's going on in there. And sometimes it would move, and sometimes it wouldn't feel like anything at all. Okay? And then what I would do is I would find the stretch that would mildly hurt it. Mildly. So obviously, one of the stretches that did hurt the most was the splits. I didn't do that at all. But if I brought this up and started to go down, I could feel it. I would just ask it to do a little bit more. And this is like a half lotus position. Just ask it to do a little bit more. And a little bit more. And a little bit more. Now again, this doesn't attack where I pulled the muscle, toward the muscle originally, but it's close to it. Okay? And I'm just asking it to go down. Then I did the other side. Then again, I come back and I rub. And for this particular injury, for this particular muscle, this is what I had to do. I would go back and forth, asking it to do more. And I was just surprised by what was tight. It's funny. I went like this on the side where it was pulled, and I couldn't move at all, which showed me how much spinal rotation was really due to the inner groin muscle on the same side I'm trying to twist to. So I would hold it, and I would breathe. Okay, I'm doing this quickly for the purposes of this video. And I'd push and I'd hold it, then I'd switch and I'd do the other side. Again, this side was pretty much no problem. Then I'd go back and I'd dig. And I'd dig. And then I would take my hands and I would bend my leg and I would rotate this muscle around the bone. Now that's bringing greater volumes of blood there. You could take a hot tub or a hot bath, that would help as well. In this particular case, I didn't. I also do other exercise besides running. I do Tai Chi every morning, anywhere from a half hour to an hour. I also ride my bike every day. What I did on my bicycle is I made sure I got nice and warmed up. I made sure I wore leg warmers. It was a little cool out in the 60s, and got a lot of blood pumping through the area. This was key, because whatever muscle fibers I broke down, whatever lactic acid, whatever toxins that were there because of the injury, the bike riding helped flush it through. I got done, I would work it again. And you'd be surprised, in a short period of time, you could work some of these muscles and some of these injuries and not have it hamper you for 6 months or a year. Okay, so this has just been a couple of weeks since this happened. It's pretty much back to normal. I work on it every day. I don't give it a break. And I just make sure that I do not do the exact thing that may hurt it. So I don't do the side-to-side backwards run on the trail watching the dog run at me, and I let go of the splits, okay, for a couple of weeks until this fully heals. And you'll be quite surprised by what you can achieve doing this. And leg muscles are commonly pulled, torn. So that's a little advice for you. Okay, thanks. And that's today's stretch on howtostretch.com.